DNA's podcast series, Let's Talk About Kidneys, provides education dedicated to exploring the journey of those living with chronic kidney disease. We're here to inspire meaningful conversations and to help people living with CKD gain a better understanding of their disease. When choosing a treatment option for end-stage renal disease, also known as ESRD, make sure you know all about the treatment options that are available to you. Treatment options for ESRD may include dialysis, kidney transplantation, supportive care management, which also includes medication treatment. Today, we are going to take a deeper dive into those various treatment options that are available with our guest speaker. Dr. Anupkumar Shetty joined Dallas Nephrology Associates in 2002. His patient care specialties include chronic kidney disease and end-stage renal disease, with an emphasis on home dialysis options. Dr. Shetty currently sees patients at our Methodist and Charlton locations, as well as hospitals and dialysis centers in the area. Welcome to Let's Talk About Kidneys, Dr. Shetty. I'm so excited to have you here. You excited to be a guest?
Yes, thank you, Tiffany. Thank you for having me.
You are welcome. Thank you for joining us. So let's get right into it. Let's get started with the basics. What is end-stage renal disease and what defines ESRD?
So end-stage kidney disease is a term for advanced chronic kidney disease where people end up either on dialysis or end up getting a kidney transplantation to live a reasonable life. It's actually a term coined by Medicare, so it's an American term, but right now it's pretty much used all over the world as a replacement for advanced chronic kidney disease.
Okay, Dr. Shetty, let's get into the questions. What is dialysis? Let's get a definition for our viewers and our listeners.
To know what dialysis does, you have to know what kidneys do. Essentially, kidneys are the cleaning stations in your body. They get rid of toxins, they get rid of extra fluids that you drink, and they get rid of extra electrolytes. In addition, kidneys help you make blood, and kidneys are also necessary for bone health. So dialysis does some of these things. Mainly, dialysis does cleaning of blood, dialysis maintains the electrolyte balance, and dialysis removes the extra fluids that you accumulate. Now, along with dialysis, we do few things to make up for what kidneys don't do. And that is, we inject medicine to help the body make blood, and we also give vitamin D supplements during dialysis or at home, again to make up for what kidneys are not doing.
All right, so what are the dialysis treatment options for ESRD patients?
So there are various treatment options to dialyze patients depending upon patient needs and patient's ability to do certain kinds of dialysis. The typical dialysis that we see in most people is where they go to a center 3 days a week and get dialyzed about 4 hours each time. This is great because someone else does the dialysis for patients.
What is the term for that dialysis that's done in center?
So that is hemodialysis. We call it, if it is done in center, we call it in-center hemodialysis. The problem with this for some patients is that they feel that they have lost control over their health because they have to go to a dialysis center 3 days a week at specific times and listen to what we tell them every time. But there are fortunately other alternatives which empowers patients and allows them to take care of their health at home.
Okay.
One of the options is home hemodialysis. There are different ways of doing dialysis at home. You can do hemodialysis or you can do peritoneal dialysis. In hemodialysis, it's kind of similar to what people do in the center, except that the machine is much smaller This is exactly how the home hemodialysis machine looks in terms of looks and size. And it's very portable. It's heavier than this box, but it's as big as this is. So it's easier to travel. And good thing about this dialysis is if they do it 5 days a week, they get to do shorter treatments, and it gives much better cleaning of blood, and people generally have more energy and better quality of life.
If a patient wanted to do home hemodialysis, can you tell us quickly how that process gets started?
Yes. So usually we like them to have an access in the arm, because in any dialysis, since blood is getting cleaned, blood has to go through the machine or go through the process. So in hemodialysis, there should be a way for blood to go through the machine, get cleaned there, and be returned to the patient. So we ask the surgeons to create an AV fistula or a graft which actually connects the artery to the vein and makes it easy to cannulate so we can get blood through the machine.
All right. You did a great job of explaining how a hemodialysis patient can be in the comfort of their home and do their treatment. So now we're going to talk about the other dialysis option. We have an example here of peritoneal dialysis that is done at home. So can you walk us through this treatment option and all the details that goes into it?
Now let's talk about peritoneal dialysis. Like I said earlier, dialysis mainly cleans blood. So unlike hemodialysis, where blood comes out of the body to the machine to get cleaned, in peritoneal dialysis, we fill patient's tummy with fluid with this kind of catheter that has to be placed by the surgeon. And when we fill this fluid in the tummy and leave it there for a few hours, the toxins from the body come to the fluid, and after that the fluid is drained by gravity. So this cycle goes on few times every day.
How long is the cycle and how many times a day?
So again, here there are two ways of doing it. You can use a machine at night and connect fluid into this catheter. So that will run the fluid and drain it as many times as we ask the machine to do it. Generally, most people do it 3 to 4 times at night over about 8 to 10 hours.
Okay.
So most people have to do 3 to 4 times a day.
Okay.
And each time, if they're using a machine, it takes about 30 to 40 minutes at night and about 15 minutes in the morning. And if they do it manually, each time it takes about 20 minutes.
Okay.
But good thing is we underestimate the amount of time people spend to get ready, go to the dialysis center, and then wait there after dialysis and come home. This dialysis, they can do it in pajamas. They don't have to get ready. So they end up spending a lot of time even though they have to do it every day. The other time that they gain by doing dialysis at home is what we call it post-dialysis fatigue. Generally, in people who go to a center 3 days a week, most of them, they feel tired for about 6 to 8 hours. Some people feel tired for a whole day to the point that by the time they feel better, it's time for next dialysis.
Excellent. Yes.
I feel that's a big advantage of home dialysis. They don't have that post-dialysis fatigue. That is 6 to 7 hours or 6 to 8 hours, 3 days a week. That much time taken away from their life. So here they get that time back.
Right.
So even though peritoneal dialysis has to be done every day, in reality they end up spending less time dialyzing and they get more quality time back to their life.
All right. That was a detailed and excellent explanation of peritoneal dialysis. Thank you so much for that. Transplantation, it's a hot topic. It's something that patients need to be aware of that is also a treatment option for end-stage renal disease? Are ESRD patients eligible for kidney transplantation? And can you describe what that process is like as far as applying for transplantation and the surgical process as well?
So many of these patients with chronic kidney disease reach a stage where complete kidney failure becomes inevitable. At that time, one way to avoid dialysis is to get a preemptive transplantation. In other words, getting a kidney transplantation even before they end up on dialysis. Of course, they can also apply for kidney and get transplantation after being on dialysis for some time. It's a surgical procedure where a kidney is implanted into one's body to replace what their kidneys are not doing. Now, depending upon where the kidney is coming from, we say either it's a living donor transplantation or deceased donor transplantation. Living donor transplantation is where somebody donates a kidney to you. So the surgeons do remove the kidney from the donor and implant it to the patient kind of at the same time or same day. The donor doesn't have to be family member, but their blood type has to be matching. Now, supposing you don't have a donor whose blood type is matching, there's a program called Paired Exchange Kidney Program, where the program will find a donor whose kidney is matching with yours, and your donor's kidney will be given to somebody else. And this is a very organized program that is done nationwide. So sometimes these kidneys get shipped to different states on the same day. In fact, the first paired exchange transplant in the hospital where I go to was one of my patients.
Oh, wow.
And her husband gave her the kidney, but his blood type was not matching. So her husband's kidney went to Washington, D.C. to somebody else. And that patient's donor's kidney went to Cleveland. And that Cleveland patient's donor's kidney came to my patient.
So I think it's a good point to make that it does not have to be a family member, because I know a lot of people think that they look at their family tree and there may be a lot of comorbidities within a family dynamic.
Right.
But you can get a kidney from someone that is not family. So a coworker, someone from the community. So I just want people out there that are listening, and I know transplantation, you hear how long the waiting list is, and people are on different lists, but you can seek out a kidney from someone that's not your blood relative.
Correct.
I just want to throw
Correct.
that in there.
If one doesn't have a family member or a friend or an altruistic donor who would give a kidney, these patients can go on a waiting list for deceased donor kidney, and wait time is around 4 to 6 years, on an average about 5 years. But till you get the kidney, you have to either be on dialysis or not be on dialysis if you're well enough to be not on dialysis. So there is a misconception that you have to be on dialysis to get the kidney. That is not true. So as long as the kidney function is below 20%, you can be listed to get a kidney. And if you end up getting kidney before dialysis, that's great.
Right.
But even if you don't, supposing you accrue 3 years without dialysis, then you only need another 2 years on dialysis to get the kidney. So there is a lot of merit to be listed for kidney well before one ends up on dialysis.
So then if a person doesn't have a transplant, is not on dialysis, what are the medication treatment options for an end-stage renal disease patient?
So remember I said earlier what kidneys do? So technically even here we try to do what kidneys do. or what kidneys are failing to do at that particular time. So one of the things kidneys do is they maintain your fluid balance, electrolyte balance. So there are medicines to increase the urine output to get rid of extra fluids. You still need some kidney working for these medicines to work. The other thing that kidneys do is kidneys help you make blood. Kidneys actually make a hormone called erythropoietin that goes and tells the bone marrow to make blood. So this erythropoietin is available as an injection commercially. So these patients get these injections roughly every 2 weeks to make blood. We also give vitamin D by mouth because now when the kidneys are weak, they don't activate the vitamin D. So we go ahead and replace the activated vitamin D. Then there are few other things.
But those are primarily the main ones, main medications that will treat ESRD.
Correct.
Okay. So then now can we transition into you giving us some background on advanced care planning?
Right. Actually, advanced care planning has to be done by all of us, irrespective of our health status, irrespective of our age, but definitely in these patients who are chronically ill. So, besides having medical power of attorney and advance directives, there are few patients who would just not want to be on dialysis. And for different reasons, they might not be eligible to get a kidney. They might be too sick to get a kidney, too sick to have surgery, or too sick to have anti-rejection medicines. These are very few patients who choose not to take dialysis, but those who do, we give the medical therapy and they choose how to spend their life before they pass.
And so then now, based on all of the treatment options, is there a patient example that you can give us that they really benefited from either hemodialysis, peritoneal dialysis, or kidney transplantation? You know, I've had 3 kidney transplants, so I know the benefits of getting a transplant, you know, from living donors, picking right back up, living life, being healthy again. So maybe you have an example of another patient that kind of sticks out that really benefited from one of the dialysis options?
Yeah. Perfect example of success of kidney transplantation is you.
Oh, thank you.
There can't be a better example.
Oh, thank you.
But I have a patient who does home hemodialysis. He works full time for a company as an accountant and CFO. He recently went on an Alaska cruise. So he took his machine, dialyzed himself in the cruise. That's a great example as to
back to living life
how we can live in spite of being on dialysis. Travel is really much easier on peritoneal dialysis than other modalities. But you can do home hemodialysis and travel as well.
Okay, wow. Those are awesome, phenomenal examples of, you know, being an ESRD patient and still being able to live a fulfilling life with travel and experiences. So I really want to talk, one of our last questions about Dallas Nephrology Associates. We have so many things that we offer our ESRD patients based on how they need to make their decisions. So can you talk about what we offer here at Dallas Nephrology Associates?
Sure. So we have a very strong CKD education program.
Excellent CKD
which educates the patients when they're not on dialysis, starting from how to slow down the progression of kidney disease, how to protect the kidneys, and in the event of needing dialysis, how to choose different kinds of dialysis, how to apply for kidney transplantation, and also how to live without dialysis if you choose to not take dialysis and cannot get transplantation. In addition to that, about 2 years ago, we started a CKD options modality clinic in various clinics in Dallas Nephrology Associates. to give a little bit more hands-on experience for patients in addition to our existing CKD education program, explaining about different kinds of dialysis, both in English and Spanish. And we have a kind of like, I call it toolkit, where we have a tummy dummy, which kind of shows patients how the peritoneal dialysis catheter looks. We also have a demo which looks like a home hemodialysis machine in terms of size and looks. And we evaluate the patient's ability to perform dialysis in our own ways. For example, to dialyze at home, they need to have eyesight, they need to have manual dexterity, and they need to have hand-to-eye coordination. So we have devised some simple tests like capping and uncapping a pen, for example, which tests their ability to pinch or manual dexterity. It tests their ability to see, and it tests their hand-to-eye coordination. And we also test if they're strong enough to pick like 6 to 7 pounds of weight. We evaluate their home environment to make sure it's appropriately hygienic and to make sure that they have enough space to store the dialysis supplies. If they're not able to do, we also evaluate if they have enough help at home. Because sometimes if patient cannot do dialysis, and if we have a caregiver who is willing to do dialysis, that is okay too. And it works great for elderly patients who are dependent on others for transportation.
Well, thank you so much, Dr. Shetty, for providing the patients and providers and caregivers. You've given us a better understanding of all of the treatment options and just defining ESRD, defining what dialysis, the different types of dialysis and transplantation. So thank you for joining us today on Let's Talk About Kidneys, our amazing podcast here with Dallas Nephrology Associates. And if anyone out there has any questions or want more information, feel free to call us at 214-358-2300. You can get more information or you can schedule a consultation. Thanks again, Dr. Shetty, for being here with us.
Thank you, Tiffany, for having me. And it's this great program. And I would encourage all the people to take advantage of this podcast and educate yourself, empower yourself. Thank you.
Thank you. Thank you for joining us today. For information about Dallas Nephrology Associates, please visit our website at dneph.com. If you found our information helpful, feel free to share it with others who may also be affected by chronic kidney disease.
Dallas Nephrology Associates' DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, End Stage Renal Disease, ESRD, End Stage Kidney Disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.